for a chest to arm conversion. So there's a few different conversions that you can do to get the port to the arm that you'll do with tunneling. This is just a picture of how they do it. They started at the chest on the left, and then they converted to the arm at the end. So there's just little 3 holes made where the line have been converted to the arm. The PICC port goes into the femoral, and then we also tunnel it much closer to the knee. So it goes into the superficial femoral vein, goes closer to the knee, so there is no chance of infection. So it is also an option, especially for those patients that cannot receive a line in the upper part of the body. This is how the PICC port, the femorally inserted central port, is inserted, and then they can be used. So nobody will ever see there is a port as well. That port, we confirm that with transhepatic ultrasound and also the bubble test. Stefan will show you the bubble test. We do the same with the PICC line. Make sure it is in the correct position and basically the same procedure. So the take-home